we'll probably start 2 minutes past like 7:30 or 8:30 Eastern time. Okay, we'll give it 1 more minute and then we'll start, right? All right.
Okay, I think we're going to go ahead and get started. So,
Yeah,
hello
let me
and
start
welcome.
Chris, let me start
Oh, yeah,
and
go
then,
for it. Yeah.
yeah.
Recording in progress.
Okay, so hello and welcome to Medicine Connect's Exploring Medical Profession series in partnership with Alliance of North American Chinese Physicians and Chinese American Pathologists Association. So, my name is Grace, and I'm a junior in high school. I'm also a co-founder of Medicine Connect, along with 2 other teams. So, a little bit about Medicine Connect. We are a youth-led organization aiming to connect medical professionals and their knowledge to the public. So, you can check out our website at medicineconnect.org, where we have a couple blogs and lectures in partnership with ANACP about a variety of health-related topics. And so, as our goal of connecting medical professionals to the community, we wanted to create a series focusing on different medical careers to help others and ourselves learn more about what certain areas of medicine entail, and specifically, we wanted to help teens who are interested in pursuing medicine in the future to learn more about different areas and like see if it sparks their interest in potential medical professions. So the medical profession that we're going to be exploring today is pathology, and we have 2 wonderful doctors with us today. We have Dr. Yanxia Li, who is a pathologist at the Advocate Christ Medical Center in Illinois and vice chair of the pathology department there. Dr. Li is also chair on the ANACP board of directors. And our second speaker with us today is Dr. Xiaoli Liu, who is a professor of pathology and immunology at Washington University in St. Louis and the director of the Liver and GI Pathology Fellowship Program of WashU. Dr. Liu also served as CAPA president in 2023. So without further ado, I'm going to let Dr. Li begin this lecture.
Awesome. Thank you, Grace. I'm going to start by sharing my screen. Okay, are you able to see my screen?
Yes, I can.
Okay, here we go. All right, thank you so much. Good evening, everyone. And we like to introduce you this lecture tonight. And I'm Yansha Li, a pathologist that works in a private hospital. And I am a lifetime member at ANACP and Kappa, which I will introduce to you a little bit more. Grace, our young host, is one of our youth volunteers for ANACP. She has done a lot of work for us as a youth volunteer and helping us spreading medical knowledge to the community and organizing lectures like this. This is a new lecture series we just started, and we decided to ask our youth volunteers to be hosts for our lecture series. All right, great job, Chris. And I'm gonna get started. I have nothing to disclose for this lecture. All right, so first of all, this is a warm message from a couple of WeChat groups. One is 美国医生职业交流学医和从医者 and another one is Cornell Pre-Med and Med 家长群 WeChat groups. We co-hosted this medical series for students and those who like to know more about the basics of medical specialties for their career development for future. And they send us these warm messages. I'm just trying to show you guys. I really appreciate that. And Dr. Chris Liu from ANACP initiated and organized this series, and Dr. Chen Xiaozhang and myself coordinated and prepared this tonight's lecture. And tonight is for us, Dr. Qiuli Liu and I deliver this talk. And I do appreciate you guys to come and to give us chance, spread our knowledge to, give our knowledge to the community in this channel, right? Thank you very much. A little introduction to ANACP. ANACP stands for Alliance of North American Chinese Physicians, 北美华人医师联盟, and this is our website. Maybe, let me see, I'll just do a quick show. All right. Yeah, this is our website. I think the best way to introduce to you is to see our website, anacp.org, and this is our homepage.
Recording in progress.
Okay, and then this is our homepage. And, we have all the upcoming lectures actually listed in today's lecture, right? And some previous lectures. And we have our stories and news and also lecture series under this one, upcoming lectures. If you click that, and this is our current lecture from today, and these are the rest of lectures. If you are interested to listen, we have lecture recordings for most of our lectures. All right, this is like, our lectures for Kappa. Kappa stands for Chinese American Pathologists Association. And for the Chinese name is called, coming up, OK, 全美华人病理学会有800多位在北美行医的病理医生。Right, 所以呢，我们就是一个很简单的一个OK, a simple introduction. Now we are coming back to my lecture. We're gonna get started, and for today's talk, we have 2 parts. Right, I'm gonna start the first part, and Dr. Qiuli Liu will take the second part. I'm a pathologist working in a private hospital. And I'll introduce to you how, like, what a pathology is about. During my part of the talk, I would encourage our students to unmute themselves from time to time, because I will have questions for you guys. All right. I want to hear if you can come up with your thoughts, your answers, when the questions are coming up. Right. And then MC, that's like from Grace. Grace just introduced the Medicine Connect to us, right? And okay, so the second part is from Dr. Xiuli Liu. She's in an academic setting, and she'll give a very inspiring talk for your training as a pathologist residence and a career development from that point of view. And then afterwards, we're going to have a Q&A session. So what do you know about pathology, right? I would like our youth audience to unmute themselves. So give me one word. What is about pathology? Do you guys know anything about pathology? One word.
It's the study of diseases.
Yes, but one word. Study of diseases. Okay, we work in the hospital. What do we do? One word. Your parent can tell you that, and you can tell me. Okay, we're running out of time. Diagnosis, right?
Diagnosis.
A diagnosis, yeah, 诊断啊，中文叫诊断, right? So, what I have learned, during my residency, one of my directors, maybe my first or second year, told me this sentence, and I was kind of really, really impressed. And I keep thinking about it until today. Pathology is the best kept secret in medicine. Pathology is a black box, even for like a lot of medical students, even for some physicians in other specialties, don't really know how we practice, don't really know, the details about pathology is more or less kept as a secret. All right, but it's a good secret. Today we'll see how much we can get to it. And this is what they call pathologists. I don't know if you have ever heard about this. Doctors, doctor, physicians, physician. Why do they say that? Why do we call pathologists this way? Right? Why? Okay, because pathologist is expert in disease diagnosis, right? We are the population, the like what we consult or serve to is the physicians. We don't directly treat patients. We don't have a lot of patient interaction, but we are the consultant or provide our expert opinions or diagnosis to physicians. Right? It's a behind the scene type of specialty. It is, but it's very critical part of the healthcare. I mean, needless to say, right? For any disease, you need a diagnosis. For any cancer or any benign entities or malignant entities, you need a diagnosis. This is what we do, right? So today's audience, I guess we have high school students, we have college students, maybe medical students, and people who are probably not in medical society, medical fields. So we'll try to explain things in more of a plain language. This is my office, right? Just from one angle, we have this fun tools like my microscope, my screens, and then this is my slides. This is what I deal with pretty much daily, and it's fairly relaxed. I mean, well, not all the time. I'd say flexibility in terms of working hours. The lifestyle of a pathologist in terms of working hours is probably not less than other specialties, but is what I really feel the personal kind of advantage I like is the flexibility. So I can arrange my schedule in according to what I need to do first, second, and sometimes if I need to deal with some other it's a personal stuff. I can, arrange that type of schedule. But this is like, but Dr. Xiuli Liu may have a different view of it. But, speaking of like from a private hospital pathologist, my life, I feel like is pretty good. In the morning I arrive and then we can have coffee or tea. We can kind of say hi around in the department just to touch base with everybody. And, you have the whole day for yourself. All right. So just a quick overview of physician training in US. All right. So you have, of course, like medical school. There are like education, prior to medical school. I'm not going to mention, but medical school, after your medical school, usually 4 years, right, you are entering a residency program. The residency program, depending on your specialty, you have 3 years. You have some like variable years. In pathology, we have 4 years. Dr. Xiuli Liu will give you more in that regard. And afterwards, we have specialty training. We call fellowships. This is also like variable years. And then after all these training, you are going to enter a practice phase. That's like when you are totally board certified, you can open up your own business or attend to hospitals or universities to work. Right, that's the general path. And for residency training, and there are different type of specialties with different lengths of training. 3 years, and some are 3 to 4, some are 4, 5, 6, 7. The longer it gets, the more surgical oriented specialties are. And pathology is like in this over here, 4 years pathology. That's like most of the pathology residency training provides. And also, but this is like not the fellowship yet. And after this 4 year, we also do fellowship. And then Dr. Xiuli Liu will give you more. Okay, so what I'm trying to actually quiz you, what are some, that slide, the animation didn't come up, unfortunately, but, we'll just pretend. What do you think of some cancer, the cancer risk factors? Our young students, what are some cancer risk factors that you can think of? Come up with some. The reason I'm asking this because pathology is about diagnosis and we deal with cancers. And that's really the highest priority in our diagnosis, right? So what are some cancer risk factors? Since this is a educational lecture, I want our young audience to probably be aware of that.
Smoking.
Smoking, thank you. And?
Burnt food.
Sorry, I can't hear you.
Like burnt food, like eating too much of it.
Yeah, okay, sure. Food, diet. Yes, very nice. Yeah. Okay, that's good. Somehow you guys know. We have smoking, alcohol. It's like alcoholic, I'd say. Occasional drinking, social drinking might be okay, but alcohol is like too much. And body weight. Right? Don't know if that's a big problem in US, right? And age and genetics, there's nothing we can do about it. We all age, we all have certain genetic traits, and then, but there are things that we are able to do. We're able to control, unhealthy food, per se, junk food, right? Radiation, sun exposure. Sun exposure is associated with what? Skin cancer. Okay, so these are the basic, the most things we can control. And I hope our young audience are able to absorb this and then, in their life, try to improve your lifestyle and avoid that. Right. And cancers diagnosed in US. So in 2023, all right, we have a few top cancers, male, female, and breast cancer, lung cancer, prostate cancer, colon cancer. These are some top cancers. These are what we pathologists deal with. The surgeons would hand you the cancer that they take out of the patient, and what we do, we have to make a diagnosis, right? Okay. Now, next question for our audience, for our young audience. For pediatric group, childhood cancer, what do you think of what is the highest, like in terms of the cancer occurrence? What's the most common cancer in pediatric group? You guys know? Give me some.
Maybe leukemia.
Sorry, I can hear you.
Maybe leukemia.
Leukemia? Okay, so the 30% is leukemia.
I think it's probably something like lung cancer from secondhand smoke from like environments or parents or something.
Well, that's pediatric groups like 18 and under 18-year-old. That's probably not. Maybe a secondhand is still like when they're in adult, is possible, but under 18. Okay, so I'm gonna show you. This is the statistics. Leukemia, wonderful, good job. Acute leukemia, especially acute lymphoblastic leukemia, and then CNS tumor is central nervous system tumor, like brain tumor, right? Lymphomas, soft tissue sarcomas, and some others. But leukemia in pediatric population has the highest cure rate, right? It's most of kids actually walk away cancer-free, leukemia-free, So, okay, now we jump into pathology, all right? I have 7 images here. This is what we see daily, all right, as a pathologist in our lab. I want you guys to unmute yourself and tell me what you can tell. What you can tell, what organs they are. They're all like, cancer in every one of them. But what do you think?
Number 7 should be the brain, I'm assuming.
Yes, thank you. You picked the easy one. Keep going. Anybody, all right?
Is number 5 the lungs?
No.
Is it kidney?
Not the lung.
The kidneys?
Is it kidneys?
Number 5 is kidney. Good. Keep going.
Number 3 is colon cancer.
Number 3, is
number 2.
part of the GI
number
tract.
2.
Number 3 is not colon. It's part of the GI tract, but not colon. Upper. Okay.
Is number 2 the intestine?
Number 1 is what?
Liver?
It's close, but it's not liver.
Is number 3
Is number
the
1?
esophagus?
Okay, number 3 is esophagus. Beautiful. Number 3 is esophagus. Number
1
number
the
1 is
lung?
lung. Thank you. You guys awesome. Number 2
Is number 2 intestine?
is colon. Yeah, it's large intestine. Awesome. Number 4?
Liver?
No.
Pancreas?
Number 4 might be hard. But it's a
Pancreas?
very,
Is it pancreas?
no. It's one of the top cancers that I mentioned.
Bone marrow?
Breast cancer?
Breast, I heard breast. Awesome. You guys awesome. And then number 6.
Kidney?
Pancreas.
Number 6 is skin cancer.
Skin cancer. That's a sun exposure caused a skin cancer called melanoma. All right. Very bad, very, very, very usually bad prognosis. And then, if it grows to this type of this extent. All right. You guys are awesome. So I have everything. You guys guessed all of them. All right, very good. So we handle these stuff, and then surgeon hand them over to us, and we deal with them this way. This is some procedures. What we do after we got the we got the cancer, the organ, tissue from them, right? We have to do a diagnosis in a way. We have to be able to divide them cut them into smaller pieces and put them into something like, this is called cassettes. All right. Now these are some piece of tissue after formalin fixation. You guys in high school would have some anatomy, and then because my son did, and he loved it. And then he had some dissections on some sheep brain, some pig heart, or things like that. And then, so those are formalin fixed tissue. And afterwards, our technologists would put them into, this is called paraffin, which is basically wax, all right, wax. And after they have them in wax, it gives a good support for you to be able to cut. We don't do that, but our laboratory, our technicians, the trained technicians would do this to cut them into slices very thin, like a few micron, all right? And then they put it in glass slides, they stain them, and eventually they come to my office, all right? So of course, I skipped many steps, but these are the basic steps of a pathology procedure from the organ, from the patient into, what shows up on my desk. And what I do is I put them under my microscope, all right? This is a pathology like working station where people do dissection. We call grossing. We call this basically how to process to cut the specimen. These are like some very specialized cutting tables with a lot of tools, device to facilitate this whole procedure. And like this is like takes years of training to know how to cut. It's not just like in your kitchen table you cut things, and then it's like we have to deal with everything very carefully and considering a lot of factors how we make the diagnosis, right? Yeah, okay, yeah, there are like some ways of cutting, and see some inking as well, right? This is a breast. Okay, a breast cancer, and then you see the dark inking, and then there are ways to cut and then ways to submit. Before I start telling you some stories about our practice, I'll give you a sense of a pathology decision-making trait. All right. So when we pathologists make diagnosis, we have to keep a few things in mind. All right. We have to decide when we started looking the specimen and started looking the slides under the microscope, we have to decide whether this is benign versus malignant. This is the top level, most important diagnosis that we have to, the first step that we have to come up with. All right. And then benign is good news for patients. It could be caused by inflammation, infection, and trauma, some drug, and then there are some benign tumors, right? But if it's malignant, we have a lot more things to do. We have to subclassify what type of malignancy. We have some general classifications. These words you may not, you're not familiar with, right? They're all pretty much ended with oma, carcinoma, sarcoma, melanoma, lymphoma, leukemia. So these are the malignant groups of cancers. And what we do, not like diagnosis, it includes so much information, the subclassifications of a lot of cancers. And also we have to tell them how ugly the cells are, how ugly the cancers are, meaning that's the grading, low grade versus high grade. We have to tell them how aggressive the cancers are. That's called staging in terms of the size and how they spread, whether they have metastasis to other organs, to lymph nodes. It's just a whole a package of information we have to deliver, from our diagnosis. Okay, now I'll start, after I finish this case, I'm going to give you a few seconds to tell me what do you think of this case, right? What do you think the diagnosis is from this clinical picture? John, 80-year-old, came to ER, and then he complained really severe abdominal pain started at periumbilical region and kind of migrated to the right lower quadrant. All right, and then the symptoms started like 12 hours ago, and getting worse and worse. And he also had nausea, like no vomiting and no change in bowel habits. What do you think, guys? It's a common, condition that kids get. Some adults also get sometimes. What do you think? What is the organ in the right lower quadrant? You can press it and think about it.
Appendicitis.
Awesome. I heard somebody call it appendicitis, right? Awesome. This is our budding pathologist. And then, okay, so this is what happened to John, right? So John came to ER with his parents, and then John got all the symptoms. So John had a radiology. This is like ultrasound. And then they saw, an inflamed appendix, which is really not the topic of the day. You will get to know more about this specialty in our other talks in this series, all right? And then they say, oh, we have to operate. We have to take the appendix out right now. And then the surgeon performed appendectomy. So basically, it's a laparoscopic procedure, meaning you don't have to open up the abdomen. You have this, some tools going into the abdomen, and then they perform this type of procedure. It just take out the inflamed appendix this way. So it's coming out. This big region is us, as pathology. What they do is they send this appendix, all right, it looks like a tail. There's some fat attached to it. This is how an inflamed appendix looks like. And they send it to us, and pathologists would start doing, assessment, cutting, and then do the embedding, all these procedures that I showed you earlier. And then now we look at them we look at the slides under the microscope. This is normal. This is John's appendix. Normal is you have all these called lymphoid follicles in this mucosal area, and then a few layers of structures, which you will learn in years coming up, all right? So this is just a nice normal appendix with the lumen, but John's appendix is so messed up, right? It's got all this inflammation. You don't have this architecture anymore. The keyword is architecture. And then, so when the appendix is taken out, pathology confirmed, yep, acute appendicitis. And then John got discharged from the hospital, and he goes to primary care or pediatrics for recovery. All right. So a little bit more about what we do under the microscope. This is John's appendix under what we call low power. Okay, low power is you have the amplification power ranging from 20x to high power 100x. This is maybe a 400x. This is not 1000x. And what you see in all this messed up areas, these are all inflammatory cells. Okay, it's all like neutrophils. This is abscess. That's what happens. And this is what we see under the microscope, and it's just fascinating. It's very interesting. And then I have a friend who was wondering whether she wanted to go into pathology or not, but she told me, I don't have this pattern recognition skills. I'm really bad at imaging in general. So she was very hesitated. And then, but I told her this is acquired skills. This is not something you're born with. It takes years for you to be able to have this pattern recognition, this architecture appreciation. So don't worry about it. It's really the training that does the work. All right. Next, Okay, pathology, morphology, right? It's in part like solving puzzles. Now this puzzle for you is to find a hidden lollipop in the ice cream cone. I don't know how well that you guys can see my picture, but there's like a lollipop among all these ice cream cones, right? I cannot quiz you on that because it may take too long. So this guy is over here. All right, so that's part of, if you imagine these are all the cells and you're trying to find one cell or a mitotic figure, mitotic cell in all these many ones, that's like, a puzzle. It's a fun puzzle for us, right? On the other hand, besides this high power, by finding the one bad guy among the others, you will be able to do actually most important is architecture or pattern recognition. Architecture, pattern, and then pattern recognition, right? So what I'm having, say, the slide and our pathologist here, and dividing by this line on this left is benign tissue. On this right-hand side is malignant tissue. And these are called glands, right? I don't know how much you guys know about it, but if you just look at the shape, these are so calm. These are nice looking and they kind of respect each other. But this is like very different, right? They're so zigzag, they look so ugly, and they don't respect each other. They're crowded, and then, so this is like a very basic pattern recognition as an example, right? But of course, they're not all as simple as that. And then next, I'm gonna just bring up laboratory medicine briefly. Laboratory medicine is also part of pathology in the US pathology training. When you go to take a nasal swab, when you get a cold, and then you're trying to rule out whether it's COVID or influenza A versus B or RSV. Okay, and then they do this, and then they sometimes they take a blood sample if you go for some kind of a routine test, and then what they do to those, they send it to the lab. And this is pathology. In pathology training, we get this part for our training as well, right? That's also a part of the residency training. Okay. Okay, I'm gonna just go through this quickly. Emily, 5-year-old, and she had complained about fatigue. Fatigue is like tired, right? Paler is like pale. Easy bruising, and an occasional fever for a few weeks. And so she went to see Dr. Hamilton. Dr. Hamilton ordered a peripheral blood test. And this is a blood draw and a blood smear, on the glass slide, normal versus Emily. Emily's, a few parameters, you don't have to know all of them, but hemoglobin is low. White blood cell count is low. Platelet is low comparing to normal range. This is a pancytopenia, all right? And then, okay, this is normal, and then versus Emily. Emily instead has a lot of, sorry, white blood cell count is high. Okay, sorry. And then she has a lot of these cells in their blood, in her blood. Do you guys have like an idea what it might be? What it might be? Now, I mentioned this earlier, actually, in one slide. Emily, 5-year-old, and then has all these, abnormal cells in her blood. She has acute leukemia. All right, she has acute leukemia, and this is the most common pediatric cancer. And then, okay, I'm gonna skip this. So what Emily had diagnosed is acute lymphoblastic leukemia. And those cells you saw in the peripheral blood are diagnostic. And there's, of course, a million ancillary analysis, other testing that Emily has gone through, right? And pathology is the key portion to make the diagnosis. When the diagnosis is made, she went through hematology, oncology, this treatment and chemo, months or even years of treatment. And then she eventually got cured and, goes home. So this is another very important aspect: peripheral blood, blood smear, bone marrow, and this aspect. We don't want to go into too much details, but pathology's role is over here. All right. And this is a happy ending. And I remember, all the time when I have something like this in my microscope, I call the pediatric oncologist right away. I say, hey, Dr. Kenner, I have this kid and he has acute leukemia. And for that one, and then Dr. Kenner, like on the other end of the phone, just paused with a moment of silence, and said in a very sad, in a sad tone, like, well, he is just like another kid in the playground. Okay, so I really feel, I feel him. It's like, this when the oncologist treating patients, and they are taking heart. Okay. Oh, okay. Now I have a brief introduction to forensics. Forensics is what? Exciting, right? You guys probably, most of you guys, a lot of you guys know about CSI, right? CSI is like this famous TV series about forensics, and then how they solve all these murders. And this is a big part of a pathology as well. Autopsy, for example, I have this interesting picture from Rembrandt, and I found it really interesting. That's like in the Middle Age, and then people started doing biopsy on a corpse, right? But now this is our in the lab we have all these tables doing autopsies, and this is to find cause of death, right? Part of our pathology training as well, right? That's it. Just a quick summary. Pathology about diagnosis. Pathology is, pathologists are called doctor's doctor, right? We use microscope, and we have laboratory medicine and autopsy forensics. That's all my part of the talk. Sorry, it went a little bit longer than expected. Now I'm going to hand it over to Dr. Liu. Julie, are you taking it over on your end? Nice, thank you. I see your slide.
We go.
Yep.
Okay.
Awesome.
All right. So let me see. I have about 20 minutes to see if I can go finish this. Okay. So today I'm going to, first of all, I'd like to thank ANACP, and ANACP give me this opportunity, to talk to the young audience about pathology, which is a very unique and important specialty in of medicine. Okay. Okay, so I have, I usually have my way of doing lectures. So first of all, I want to share my personal stories because, I think if I can do it, many of you in the audience, I'm sure will do it and be able to do it. Okay. And then I will briefly talk about pathology training and also, practice. So I was, actually quite old. So let's see, just see in the 80s. Okay, so I passed, that one of the big exams, so got accepted by the medical school. So I was born in Hunan, a very rural area, so it's close to Changsha. And at that time, train is the only long-distance transportation. So I took the train, 36-hour train ride from my hometown to Peking University. At that time, we called Beijing Medical University, and now called Peking University Health Science Center. So they changed the name. So I stayed there for 6 years, and that is med school. And my point to get you is if you're in med school, you need to study hard, but also you need to enjoy, the places and the peoples and do all kinds of things young people do. So, the pictures, one of them is Great Wall, another one is the Summer Palace. I'm sure, many of you have been there. So that is med school. So I would just say, so people would ask, what will make a good doctor? And at the very beginning, I would, see, I kind of, lost. I truly don't know which field I want to go. And I know, but I know I want to be a good doctor. So in the second year, this summer break, I kind of debating I should go home or can do something, stay on the campus and do something. So at that time, our medical school actually has one of the greatest neuroscientists. And so for some reason that year, he said, he posted something that he had some observership in his lab. At that time, I'm very quiet. I'm very shy kid when I was young. So for some reason, at that moment, so I decided to write a letter to this professor, and eventually I got the observership. So before, I started the observership, and then we had a 10 minutes talk, and that 10 minutes talk stayed with me for the rest of my life. And so what we talked about, so basically when you, as a research, if you write a proposal, you put all kinds of exciting, hypotheses, ideas on, you think you will make a breakthrough in the field. So very excited, has very noble, aims. But when you do the experiment, okay, and that is very tedious. Some of the steps are very boring, time consuming. Okay. And when you're trying to collect the data and trying to publish this, writing up, it's just a lot of work. Okay. So this is the point I want to get you. So if you really want to do something well, you have to put a commitment and be able to carry, put a good effort to carry the task through and get to the end point. Okay. So that is 10 minutes, so it's served me well. So after the 6 year of medical school, and I went to the northern east part of China. It's Dalian City. It's coast city. It's beautiful. So this is the seaside, the beach. And my hospital at that time, the hospital work is very in the center of the city. So this is the Times Square, and the hospital probably is 5 or 10 minutes from this People's Square. And my dorm is like maybe 1 or 2 minutes from this area. So it is a very good place. I would say most of the young people think, maybe this is a time or a place I can settle. But as young people, you always have something. You need to do what your heart told you to do or tells you to do. So at that time, I just decided, that is a very busy service. And so I remembered in one of the ER night shift, I saw 105 patients. You just imagine it's very busy service. So my diagnostic skill, clinical skill, is very good after a couple of years, but I want to know more about the nature of the disease. And also there was a pressure, peer pressure at that time. So if you're good enough, you are supposed to come abroad, to get a good education or graduate school education, and to know more about research about medical sciences. So that's what I do. So the first stop is University of Arkansas for Medical Sciences. Is a decent medical school and treat me well. So I did the physiology and biophysics. I meant to get a PhD from that program, but for some reason, it's a long story. So let me just cut it short. So I did spend 1 year doing research, and that is a molecule called HER2. So this is a molecule. Its overexpression in the breast cancer is associated with bad outcome Yeah. But later found actually there's a good drug antibodies against this molecule and this protein, and actually provide very good treatment effect for that type of a breast cancer. So, just remember there's something when you touch eventually is going to kind of lighten you. And then I worked 1 year, and again in the pediatric tumor. It's called rhabdomyosarcoma. It's a muscle tumor, and it's quite malignant. But I have a clinician, which oncologist is quite passionate about it. So we did a p53 molecule in this tumor. And so this is for the audience, for the parents in the audience. If you do medicine, you practice medicine and trying to collect with your kid, this is maybe something you can talk about. And also for the audience, young audience, so if you learn something exciting and your parent is doing medicine, this is something you can collect. The reason is I bring this up is I have a daughter, and one day I was doing something and she called me and said, "Mom, today, we learned cancer biology, and I learned something about p53." So we kind of keep on talking almost, for more than 1 hour from the p53 eventually to the PD-L1. That type of a topic, you can truly empower young children or young adults. So, and give them haha moment or aha moment, and they can, choose the career they think they will enjoy. Okay. So after that, I did, I got a PhD in toxicology. Why I want to mention it? Because, I worked on the cell injury and cell death. And this actually human disease, and basically is a cell injury or sometimes a cell death and associated chronic inflammation and then DNA damage leading to the tumor or neoplastic process. So this is laid a very good foundation for my career, which, the pathology career. And also I went to the National Center for Toxicology Research, and this is a basic research center to determine the tumorigenesis of some toxins or environment, toxins, and using some animal models. So this is very good. And at that time, there was one thing was so popular, and a mentor kept on mentioning to me, this is called microsatellite instability, called MSI. The reason is very important was very important now, because for tumor with this phenotype, that means there's so many mutations in the genes. We have an extremely useful treatment. It's called immunotherapy, and that is advanced or breakthrough in oncology. So I just want to say anything, you learn when you are young is going to benefit you, but you just don't know, what type of a benefit you will get from those experiences. So just to summarize, I spent, 6 years in medical school, 5 years as internal medicine residency and attending, and then did 8 years of research. So that is my pre-pathology, period. It's long, but that laid a very good, solid foundation for my, career in pathology. Okay, so I was matched to a pathology residency program. Okay, so University of Alabama in Birmingham. So the name or the reputation of the program is important, but more important is the people. The people is going to train you, your mentors. So I'm very fortunate to have great, mentors. So Dr. Jane McDonald was the chair at that time, and Dr. Bruce Alexander was the program director. Dr. Jean Seeger was the AP director, and Dr. John Smith was the CP chief. So all of those people are so kind, very generous with their times. And I remembered before I went out for job interview, Dr. Jin Seger actually look at my PPT slides by slides to trying to make changes, to make, proofreading all of them. Even though he knows I may stay at UAB as attending or I go away, move out. But this type of a training and mentoring, that's what you're looking for. So it's not only for the program, the reputation of the program, it truly is the mentors in that program. And we're saying, we did very well in terms of literature review and critical thinking and problem solving, because those are the skills. Those are the soft skills, but it's core skills as a pathologist, because if you don't want to be replaced by some AI or digital pathology or something like that, you truly have to be able to be creative and to be critical. So those are very important attributes. So I also used more of those 4 years. I did fellowship training in GI and liver. So I got 2 great mentors. Their mentoring style are absolutely different. So I got to learn, the best from each of them. So, and in this year, you get intensified training. So you become very good at this subspecialty. And so when I finished the program, the residency and fellowship, and then was, facing which way I should go. I go to the private practice or I go to the academic, pathology. So at that time, my mentor, Dr. Audrey Nesby, basically told me, and at that time we have a restroom, we have a room for the residents. And so there is bookshelves and there is tons of pathology book, but there was a series that stood out. And those are like 13 books from Cleveland Clinic called Foundation Diagnostic Pathology. And Dr. Nasmi, they told me, Shuli, you are good with this. And, it would be fantastic if you go to this place and be able to, write some of this or at least contribute to some of this. And I think that is a very good idea. So that is the point. Always listen to your mentor and truly, kind of know what you are good at it. So eventually I went to Cleveland Clinic. It's a good fit for me. And when you start your job, you truly need to focus and, you need to build your skills. It's like a case by case, one entity by one entity. And then eventually after years, I think I'm diagnostically strong. So what else I want to achieve? Of course, as a human being or as a physician, you want independence and also you want confidence. Okay. So this is what I, decide I want to leave Cleveland Clinic. So, and I went to University of Florida. And so, became a professor and also directed the GI pathology and the fellowship. So, and spent there for 5 years and built up that program very well. So, and I think that is something I'm very proud of for the clinical work and for that program. So when opportunities come, so I came, to Washington University almost 3 years ago. And again, I'm in charge of the GI pathology and the fellowship program, training program. Okay, so Dr. Nee previously mentioned, so what is pathology? I guess, you are very smart. It is a study of suffering. Okay, so it is a scientific study of disease, including patterns, we mentioned that, and causes and mechanisms and effect of the disease on the human being. Okay, so, pathologist, a physician studies or practice pathology. Okay, so as a diagnostician in pathology, what you do, the fundamental task, either AP or CP or molecular, okay, so it's tell what type of disease the patient has, and that is diagnosis, okay, and tell how bad the disease is. That is a prognosis. And tell if the treatment will work, you do some biomarkers, and that is prediction. until if a treatment worked or not, with the blood or with the tissue after treatment, that is called response. So in the United States, we have about 18 to 20K pathologists. Majority of them work in private practice, just like Dr. Lee, and 20 to 30% work in academic practice. It's just a career choice. There's no, not which one is better, which one is not as good as. It's just a choice. It depends what you want to do. So in community practice, it's a patient is case-centered. So you relatively have a good balance, work and life balance. And in academic practice, so you have three, it's called Trinity. So you have clinical work and research and also education, okay? So types of pathologists. So on this side, you have, this pathologist because she has a microscope, okay? And make a diagnosis on the tissue most of the time. And this is the natural medicine is also called clinical pathology, okay? And also there is forensic pathology, just to determine the cause of the death. And this has sometimes you have to go to the court, and now this is the most hot subspecialty of pathology. Okay, so pathology department, have a clinical service branch, have a basic research branch most part. And the clinical service branch usually is bigger and includes clinical pathology or laboratory medicine, anatomic pathology, molecular pathology, and some places have, other things. Okay. And so the training as, start from high school. So that is this, medicine collector that is more, that group, and also that is ANACP and CAP. We're trying to encourage students who has interest to develop interest in medicine and in pathology. So the interest starts from high school and end in fellowship, and then of course you practice as a pathologist. And this for the residency is most people will do AP and plus CP because this is not absolutely different. They are complementary to each other. And sometimes a diagnosis, you need AP and you also need the CP and sometimes molecular. So it's the more you know, the better. So AP plus CP will be a 4-year training program. And if you have a strong research background or you have a strong interest in one of the subspecialty and you want to become a good expert in very short period of time, you can do AP only or CP only. That can happen. And after that, you do 1 year or 2 year subspecialty training. So depends which subspecialty you go to. So overall, it's like a 5 to 6 year training. So it's in the probably within the mid of all of the medical subspecialty or specialty. So that is reasonable. So American Board of Pathology, so is a certified physician in the specialty of a pathologist. So we have a primary certificate. So basically, after you finish the residency, you have to finish or pass the board exam, and then you get a certificate and be able to practice. Okay, and so so this subspecialty certificate, there is some need the certificate, some doesn't. And the general surgical pathology is the bread and butter. So we have a large volume of cases. I'm a GI pathologist. I've received gastrointestinal fellowship training. So those just, so 4 years plus 1 year, that's 5 years for most of them. So after you enter the residency program, just like, we're not expecting you to know everything because you just enter the training, but we do have a set of milestones and you have to reach along your way of, your residency. So This includes patient care and medical knowledge and system-based practice, and also practice-based learning and improvement. And you're expected to have develop a very good professionalism and also develop interpersonal and communication skills. So this is just one of the examples. So at the very beginning, you're at level 1, and when you graduate from the residency program, you are expected to be at level 4. So level 5 actually is for expert. Okay, so what do anatomic pathologists do? So, and this is every morning I come to the office, and this is a busy day. So slides are in this tree, and this is my office. It's actually to Dr. Lee's office. So you have the microscope, and you have a couple of monitors. Okay, and as we're doctor, and we so for those difficult cases, we help with each other to get to the best diagnosis to the patient. So, and also for those educational cases, we share. So usually you can tell. So this is the attending pathologist, and those are probably the resident. Okay, so. So why I want to be academic pathologist? Because we do multiple things. First of all, we serve the patient, we render diagnosis, okay? And this is, if you do 5,000 cases per year, and if you work for 35 years, so basically you will touch lives of 100, you will work on 175,000 cases. Okay, so it's a lot. You touch a lot of people's life, and you educate next generation of residents. Okay, and also you do research. If there's a clinical or translational research, there's a question, there's no answer. As an academic pathologist, you will be able to find the niche, and you do the study, you find the answer, you publish, and the other people can go and use the answer you found. So this is another layer of impact. Okay, so before I end this talk, I want to see what's the power of pathology. So for the audience, the parents in the audience who doesn't do medicine, okay, so pathology in America is completely different from pathology or laboratory medicine in China. This is a very well respected field. Okay, so all of the diagnosis we render, all of the opinions we give, have significant weight on the clinician and the patient's treatment. Okay, so this is the power of pathology in real world. Okay, so we know in 2019, okay, so late 2019, we know there is cases pop up in Wuhan. Okay, the patient had fever, had pneumonia. And so after, very short period of time, we'll be able to, identify the new virus by sequencing. And also we culture that virus using some respiratory epithelium. That is virology. That is clinical pathology. Okay. And after that, we'll be able to develop a diagnostic test using a molecular pathology approach. So that again is molecular pathology. Okay. And so after that, some of the patients died. So we learn from the dead people, okay, the patients. Okay, so we did autopsy. Okay, so we found what happened in the lung, what happened in the heart, in other organs, and what is inflammatory, type of cells. So basically find the pathology changes and possible mechanisms by autopsy. And with that, eventually, in very short period of time, this country is be able to develop the vaccine and also develop a very effective antivirus treatment and eventually end the COVID-19. So start from pathology, eventually this area, with science, with public health, and with clinician, we overcome or claim victory, over this disease. So, and I think pathology, this is a power of pathology. Okay, so future of pathology, and I know some of the parents worry about, is this job is going to be here for, for years? Yes, it will. The digital pathology is a big movement at this point, and this is good because it provides, very good job flexibility. And this actually is the working station in the future. Okay, so you have monitoring here, and this is your chair. And basically you look at the slides and you sign out. So this is great. And also, with the slides digitized, and we can develop some artificial algorithm, and we can use deep machine learning, those things to provide more precise or more detailed information, and that is precision pathology. So that is a great thing. Of course, molecular pathology, is very popular, and this is a subspecialty of pathology. It provides a better and deeper characterization of disease, particular tumors, and this gives us opportunity to develop or to find those therapeutic targets. So that is very good. Informatics, with more information around an event, we'll be able to give better diagnosis. And of course, pathology, will be the designer or co-designer, what the system, what information we're going to include. And there's other technology I'm sure will happen, but those will increase our efficiency and for the patient safety. So we don't worry about it. So it takes a village to make a physician. Thank you, parents, schools, peers, and friends, and communities like ANC and Kappa, but most of all, yourself. You have to make a commitment, okay? You make a decision, you make a commitment, and this is a career quite, fulfilling. And so being an academic physician or pathology, what you need is some, attributes. I think most important, you need to be very curious, something you do know, you want to find, an answer for it. And of course, the hours is not as good as a private practice. It's not a 9 to 5. It's 9 to 5 belongs to clinical cases. You probably do the writing in the early morning, or you do the thinking in the evening and writing during the night. But, as long as you enjoy it, you will be able to do it, okay? And there is, office, you're always, very crowded, and you have cases, and you have there's a lot of things, and also sharing spirit. That is something. If you want to do academic medicine, you have to, first of all, you should be able to have the ability to share. You have the content, okay? The answer. The second, you should be willing to share, and you're happy to share. So that is very important. So, this is my contact information, and this is from our website. So if you want to know some general ideas about pathology training, you can go to this place. And this is my email, and this is my Twitter, and now it's called X account. So feel free, and wish you all, luck, good luck. And I think that's what I have.
Julie, do you have the Q&A session?
Oh, yeah, you won. Yeah, okay.
Let's show that one. And
okay, let me see. I stopped. Okay, let me see. I saw that there is many questions in the Q&A. So, but let me see. I do have the questions. So those are the questions. You want to go first?
yeah, we collected some questions. This is from ahead of the before the lecture, right? So some are in Chinese, some are in English. 病理工作主要有哪些？时间上有没有灵活？工作环境需不需要不需要与病人打交道，对吗？沟通方式是什么？孩子是什么样？孩子适合做病理？将来 AI 有什么影响？我大概说一下，就是 well, we actually covered a lot during our lecture. Right. And then we do have some flexibilities, which I truly enjoy. When I started my residency, all right, that was a 20 2007, and I was a mother of two. Okay, two boys, and I truly enjoyed the flexibilities of my, even my residency training, and I was able to attend to my kids, my family while I was in training. But I mean, so I do say flexibility is a big advantage of being a pathologist, and in my view. Yeah, we don't really interact with patients. You can see this as a plus or a minus, right? For me, I mean, personally, I truly enjoy it. I mean, I feel the pain from, the example that I gave you, but I'm just trying my best to help our clinicians to render the diagnosis, to give them guidance of their treatment, right? How they're and to give them a prognosis of the certain cancer, certain disease from our pathology part. So I'm like, trying to help them this way, but not directly interact with patients to treat patients. I see this as a plus, but of course, if you truly want to see, I have to interact with patients, I have to see that part as a very crucial, important for my medical practice. I would say you guys have time to find things out, but the only thing is that you don't get enough exposure to pathology in medical school. You don't know enough about it, and you feel like a pathology, no patient interaction. I guess that's probably not a good specialty. This thinking is out there, but remember, pathology is the best kept secret in medicine. So OK，与医生交通的方式什么为主？We have like so many diverse ways to communicate with the peers, the clinicians, or physicians from other specialties. That's not a problem. Nowadays the communication is just very easy. And 什么样的孩子适合做病理？Well, as Julie mentioned, if you have curiosities and then you like to study things, I think pathology is just so much fun. I mean, you're never gonna get bored because you're exposed to a big world under the microscope. It's just, I think this is amazing. I mean, I just love it. It's puzzle solving, it's problem solving, and it's hard to get to the point unless you dive into it. Deeper you dive into it, the more fun you're feeling. So, but at this point, it's hard to convey you to make you feel like my fun, right? Unless you are part of it. So that's my part. I'll just go through the number one. Shuli, do you want to go ahead for the AI part of it?
Okay, the AI part. Okay, AI just mentioned. So artificial intelligence, it does have a significant impact. It's going to have significant impact on pathology and the way we practice pathology. So, but I give you an example. The AI, the current AI. First of all, there's a couple of things. Those algorithm training is by expert pathologists. As long as you're good, you will always have job, and that is the thing. So the pathologist trained the AI. Okay, so that's number one. The second one is the pathologist is the end user of the AI. So you have to make sure this AI is good, is applied to the entity you look at. So, and the AI, they do things differently. Okay, they can give you very quick, very detailed information, and they can, very consistent. But pathology, human being, our brain is much more sophisticated. So, and that algorithm cannot, so give you a diagnosis, cannot. You have to give, an idea what's going on, and then you decide which AI going to use to help you. Just like a stain, the immunostain, we have so many, stains. So eventually actually, which one we use is at the disposal of the pathologist. So I don't worry about it, but it will make your job more enjoyable and make the pathology more precise. And so probably is good for the overall for the patient's care.
Awesome, thank you. So the next question, actually, we'll just, we have talked about it in our lectures, including the residency training, and it's usually 4 years, and then afterwards, like 1 or 2 years of fellowships in different specialties, and then you will pick, like for me, I do hematopathology and surgical pathology. I don't know, these names or terms might be kind of foreign for you guys, but don't worry, those are, many years down the road. And 工作单位主要是大公司院。So yeah, as Julie has mentioned, we have private practice, which is like private companies or hospitals or academic settings like university settings. These are the things that you will find out when you start your training, and then you will decide at that point. Right, so it's like there are some, like probably not too many in pharmaceutical companies as well. Advantage, disadvantage of working as a pathologist, we kind of touched on this, right? No patient training, but we have the flexibility along that sort. We're not going to expand on that since it's kind of getting late. 病理 match 要求 research 需要嘛 basic science research or clinical research. Match, that's like same as like some other specialties, but the most important thing is that you need to know what pathology is, right? And today's lecture will give you a good guideline if you're around that like a stage of thinking about your specialty, like matching, but you need to know what pathology is. You need to have passion. You need to feel like, oh, I'm going to enjoy pathology. Because in our training, we do have actually other specialties, like residents from other specialties switch to pathology. I've seen like internal medicine, the surgical pathology, surgical residents switch actually in their second year to a pathology residency training. I've seen one in my whole career from a pathology resident switched out to internal medicine. So you have to know what it is and feel like I will enjoy it. It's the passion, right? Research 有需要吗? Yes and no. I mean, it's not absolute before you match, but if you have some, that would be good. Basic science or clinical research. I don't think, it's like any type of research, if you have some even patient exposure, some research experience, that would be helpful, I'd say, but not 100% required. I've seen there are some in the chat boxes, a lot of comments and some questions. I think it's hard for us to go through those questions. A lot of them are discussions, right? You guys are very active. It's very good points, good discussions. So I think we're gonna, unless you have some burning questions, you can bring it up and just open up unmute yourself, you can ask. Otherwise, we're gonna finish in a few minutes. All right, yeah. Thank you guys so much for your time. But any questions you guys wanna just to speak up, unmute yourself. Students and parents and audience and anybody as well.
No, so Yinxia, actually the next question, and I think is analysis and deeper dives for information the main point of this job. Yes, as a human being, you think, and you synthesize, you collect, synthesize the information in a very meaningful way, and to make the diagnosis. Yeah, so AI will serve a tool for pathology. I don't think we'll replace a pathologist. A lot. sounds like writing a lot of paper on studies, developing drug directly involved. Yes, and actually there is a point. Okay, so pathology sounds like writing a lot of papers. That is true or not true? It depends. So if you practice in private practice, and then you probably don't write papers, but you do write report. So writing skill still essential. So developing drugs and medicine directly involving pathology, the paper for the pathologist. Yes, pathology is extremely important in the drug development. That's the reason I mentioned the HER2, I mentioned the, those MSI, those things. And also pathologist is considered the gold standard for many disease, okay? So if the clinical trial, many times they will use histology, that is pathology, as the primary endpoint of that clinical trial. So it is like many research with no, it's not a research. This is more a diagnostic process. So with flexibility, that means, because you are not dealing with urgent cases always. So if you come a little bit late, and you can live a little bit late. It's not like you can let the case sit for a couple of days. You cannot, but you can leave a little bit early, or you can take a break during the day if you have something you need to take care of. So it's, yeah.
It's comparing to other specialties, like if you have to see patient, right? Your patient is scheduled at a certain time, one by one. So you're like, you have to go with the schedule as much as possible. And pathology, in terms of flexibility, is that I design my schedule. I want to, when I want to start, when I want to finish, when I want to do which type of cases. This is a type of the flexibility. You're not facing patients. This, sorry if I did not make it clear earlier. This is a kind of a flexibility we're talking about, right? Okay, I think anybody else, any questions? And we're kind of wrapping up. It's about an hour and a half already. So awesome. Grace, you have.
Yeah, sure. Thank you guys. Thank you, Dr. Lee and Dr. Leo, for this very informative talk. I know I learned a lot about pathology today. But I think that's it for today's lecture. I hope you guys learned something. I know the chat was very active, so thank you guys for participating, and I hope you guys enjoyed. And stay tuned for future specialty talks, because we're planning on doing more of these. So yeah, we'll keep you posted, but that's all we have for today. And thank you for everybody for listening and tuning in. And obviously thank you to our wonderful doctors for doing such a great job with this evening's talk.
Okay.
Thank you, Grace.
Okay,
Yeah,
bye-bye.
Awesome. Good night, guys.
Okay, good night.
Good night, everybody. All right.